Welcome everyone to Your Health Partner, brought to you by Lehigh Valley Hospital, Hazleton, raising the bar in health every day. I'm telling you, my friends, it's just amazing what's going on. We have the best health care, I'm telling you, in the country. As you know, on the shows we try to bring doctors on and try to let you know who they are. Most of you may know these doctors, but joining me today is Dr. Stephen Evans. And Stephen's certainly no stranger to the area. He's been practicing over 20 years. Doctor, it's nice to see you.
Nice to see you.
I always learn something when I do these shows. I get free medical advice.
That's good.
Okay, good. So, you know, people who know you know who you are, okay? But some people don't know you. So, where you from? Where'd you grow up in? Yeah.
I grew up outside of Shikshini, so in the region, in a little town called Huntington Mills. My mother was a nurse. My father was a carpenter.
So, a carpenter. So, when did you decide you want to become a doctor?
Oh, I was pretty well decided early on.
I'm not hammering these anymore.
But it's the physical labor helps teach you something. And actually, like when people ask why I went into medicine, you know, they think it's my mother, but it's really not. I mean, the healthcare part a little bit with her, but what I do is sports medicine, and it's a very structural kind of thinking you have to do. And I find myself thinking like how my dad would approach things.
So your specialty is sports medicine and family medicine?
Yes, I do both.
So, you know, I always say when I'm interviewing some people is that, you know, you have to have the passion for what you do. Okay, so tell me about the passion you have for what you do and what you see.
So what I see, a whole lot of musculoskeletal kind of complaints, whether it's back pain, knee pain, hip pain, whatever. The passion is either figuring out something that people have either ignored for a while or kind of tossed off to like this, you just have back pain, take some Advil, and actually figuring out the problem and getting to the right solution. Sometimes it's not a solution, you know, that's enjoyable, but when you actually figure it out and get to educate the patients, and this is the problem, this is what's causing it.
So practicing, what are some of the most common conditions do you see?
So probably the most common, if you looked at my schedule, knee pain, shoulder pain, back pain, neck pain, but pretty much any of the joints.
There are specific methods of treatment for each one of these conditions.
Sure.
Okay, and so some of them require a lot of physical therapy. So tell me how one would look at that. In fact, I'm going to make you look at something after the show. It just reminded me, my neck is hurting me. What would be some of the common treatments that you have?
I mean, to generalize everything,
yeah,
there's kind of a spectrum I always look at of what you need to do. And sometimes it's pick and choose off the spectrum. The most, we'll say, conservative would be home exercises, which we can give you in the office. Physical therapy would be kind of in that range as well. Sometimes it's bracing, sometimes it's casting, sometimes it's injections with either steroids or there's other materials we can use in different joints. And then sometimes it's surgical.
Yeah. Now, when someone says to me sports medicine, okay, and then of course there's family medicine, I'm going to ask you the difference, but when you're talking about sports medicine, relies to, do you have to play sports?
Oh gosh, no.
Okay, all right, because when I'm thinking sports medicine, I got pain here, but I'm not a football player. I got pain here, but I'm not a baseball player. I mean, stupid, but the point is, you know, the concept of sports medicine.
So one of the misconceptions is I just see athletes. I would say 90% of the patients I see are over 50.
Okay.
And almost none of them are athletes. I might have one or two athletes a day total on the schedule. Yeah. But yeah, anything musculoskeletal we can generally see. If I always consider myself like the guy at the airport with the lights. I don't land the plane. I don't fix the plane. I know where the plane goes.
Yeah.
If it's something surgical, I get you to the right place. Yeah. In other cases, I can handle, you know, probably 85, 90% of what comes in. There's also other things with sports medicine we deal with that's not musculoskeletal, so it kind of differentiates from the surgeons.
Such as?
asthmatics who want to play sports, diabetics who want to play sports, concussions, anything that's medical that would interfere with participation. And it's not necessarily sports, it could be work as well. What we refer to as the industrial athlete. So somebody who works in a warehouse that's got shoulder pain. Well, what do we do to help them there? Or somebody, let's say with the warehouse example, who's got asthma and every day at work it's getting bad. There's things we can do with that too. And we kind of overlap with the family medicine, and that's kind of why a lot of us have the family medicine background.
So here's the question. Okay, the question is this, and we were talking about this before the show. Sometimes you have a shoulder pain, or I'll take an aspirin. Okay, it'll go away, Sam. Just take a couple aspirin, etc. And then a week later you still did you take the aspirin? So what happens is you don't think of the pain as go to a doctor. It's just a pain in the shoulder. Do you have that? And then all of a sudden you should have come and seen me maybe a month ago.
Yeah, there are some specifics, things that the quicker you see me, the better you're going to do overall. I would say most people in general put it off.
Well, yeah, I would be that person. Yeah. My wife would be kicking me out the door. She's a registered nurse. But I would say, I'm not, you're going to the doctor. I mean, when do I go see him?
If something's significantly interfering with your everyday life, you should be seen. It's because there's probably something we can do about it.
You mentioned the fact that you're taking sports medicine and then it goes into family medicine.
Yeah, there's some overlap.
Yeah. So what is that overlap?
What does that overlap? So when medical conditions kind of play a part in the problem. An example, you ever hear somebody with frozen shoulder where their shoulder kind of tightens up, they can't move it. Really common in diabetics. And it could be for almost no reason whatsoever, but stressing, getting the diabetes under control, getting them into physical therapy, getting the shoulder moving, and counseling them. This is a long-term problem that we got to keep the diabetes under control and hopefully minimize the chance of this coming back.
Being in the muscular business, okay, and what do you recommend people? I mean, when you say exercise, I mean
anything that gets your heart rate up for a good amount of time, and the recommendations keep changing all the time. But I think they said the current one is 90 minutes a week. Okay. I could be wrong on that one.
Yeah. But if you stay active.
Yeah. The worst thing you can do is sit on the couch and watch TV. Sorry.
Are you sure your name is not Debbie Lasant?
I'm pretty sure.
That's what she says. You're going to sit on the couch, you got to be active, But, I mean, it's okay to watch the Sam Lasant show. Now, come on, doctor.
It's absolutely okay.
Okay, that's okay. But you're talking about if you're not
walking,
active. Yeah.
As far as the activity, again, there's also a spectrum. You don't want to be doing really extreme sports, especially as we get older.
Yeah.
Like the parkour and extreme mountain biking. That you're going to have some injuries. There's no way around it. But the walking, swimming, pickleball, tennis, golf, anything that gets you out there and gets the blood moving.
So what you're saying, Dr. Evans, is that anybody who has any kind of pain, okay, address it.
Right.
Okay, don't just camouflage it or Band-Aid approach it, okay? Phone number is on the screen, my friends. Dr. Stephen Evans, local guy, and as you can see, very pleasant. We have it's nice to have doctors have that great bedside manner, and this guy has it. Phone number's on the screen if you want to get any information about it. If you're suffering from pain, go and see him. We're going to take a break. We come back. We got another lot of interesting guests. Well, welcome back to Your Health Partner, brought to you by Lehigh Valley Hospital, Hazleton. My friends, remember, they keep on lifting the bar 24/7, ssptv.com. You can watch all of our shows. Now, joining us now is the person, Tammy Torres, who is the president of Lehigh Valley Hospital, Hazleton. So nice to see you, Tammy.
Always a pleasure to be here with
nice
you.
When you come back on the show. We have a program that you offer at the hospital for people that are out and have financial concerns, okay? And it's called PATS, right? Tell us about that, and then we'll talk to our guest.
So I have with me today the director and also the assistant director. So I'm here with Robyn and also Farrah really to talk to the community about this program. And it's going to offer them financial assistance, and they'll get more into that. But the important thing is what we see at our community hospital is folks delaying their care. Because they feel, well, I don't have insurance. So I wanted to bring this forward so our community can see, hey, there are avenues through the hospital that when you come to us, that we can help you secure insurance. So that's why it's so important that we're here today speaking to the community about this service.
I was unaware of that. And you're so right, because some people, don't have the money insurance, they get sick, and they're fearful of, so they hold off on care. Tell me about, Robyn, you're the director, right?
Yes.
Of PATS, okay. First of all, what does PATS stand for?
Physician and Tactical Healthcare Services.
So what is it?
So we work in a partnership with Lehigh Valley Hospital, and we help the patients that come in that either don't have insurance or maybe not enough insurance, and we help them apply for Medicaid so that they can get care urgently. They don't have to wait. We actually will meet with you right in the hospital when you come in, whether you're admitted or if you're coming in through the emergency department. We have staff on site that take you from A to Z and help you with every step along the way, because we know it can be confusing for everyone. And we have highly trained individuals that can help you fill out the application. We gather all the documentation that's necessary for that application. We take that out of the patient's hands, and then we submit those applications to the Department of Human Services to have them, be applied for Medicaid. We interact regularly with the Medicaid office, so the patients don't even have to be involved with that. And we gather all the documents, submit until a decision is made by the county assistance offices.
So what kind of assistance is it like?
We help the patients apply for Medicaid, which in turn will get their bill that they're currently in for. And it can also, depending on which categories they're in, they can get ongoing services, which will help them with any outpatient costs that they have, pharmaceutical bills that they'll have.
Okay, so what if someone does not have insurance and they're okay, they're not sick? Mm-hmm. All right, so we figure, well, let me apply for this now in case something should happen to me. Can you do that, or do you have to be in the hospital to apply for this?
So for Lehigh Valley, we see the patients both on the inpatient side and the outpatient side in the emergency department. If you are in the community and you need to apply for Medicaid, you would go to the county assistance office directly, but you can actually do everything online now through Compass.
Farrah, you're the assistant director.
Yes.
Okay, what are your duties and responsibilities?
Yeah, so I oversee, our staff. We have, like Robyn said, we have staff right on site at all the Lehigh Valley locations so that we can meet with your patient's bedside right when they're in the hospital. So I oversee all of that, all of those staff, making sure we're seeing those patients, we're submitting the applications timely. We can also go to, if we don't agree with the decision that the county made on your behalf, we can file an appeal for that patient and go to a hearing with the Bureau of Hearings and Appeals in order to do that for that patient. We, like Robyn said, we're there till the very end. And even if a patient does not qualify for Medicaid, there are other options, like the financial assistance through Lehigh Valley itself. And also through Pennie, which is the Pennsylvania marketplace, which we'll get into at a later segment.
So, these paths is in hospital really to support the community as they come in to seek medical care. So the purpose behind it is we want them to come in before we get into a critical situation. So they're on hand, for anyone that finds themselves coming in through the emergency room for something very simple. It could be complex. So if they're identified, they don't have the insurance, that's where they step in to see how they can help to defer some of these costs.
What were some of the eligibility requirements?
So they take a look at your income, and there's certain income limits, and then you have to provide documentation, date of birth, citizenship, and if you're not working, we can get like a support letter from somebody that's maybe helping you in the community. And then that all gets submitted to the county assistance office to make their determination. And I also wanted to add that If you are unable to complete the application while you're in the hospital, maybe you were too sick while you were there, not feeling well, we also have representatives that will come to your home. And you don't even have to leave your house. We will scan your documents securely and can get everything completed for you, right from your home if need be.
And that's what I was going to ask you, because if you're coming in the hospital, the least thing is,
Correct.
especially when you got, all the paperwork. I understand it's important, but the patient's concerned, and we want to get this person in and being taken care of. Is this a long process, Farrah?
So it can be, but we are there to help you, like I said, through every step of the way. We actually help if, say, you're working and you don't have your pay stubs. We can help with that. We can send directly to your employer. If you need doctor's forms, which happens sometimes, we can send directly to the doctors for you. So we try and help as much as possible to shorten that process. And if you have, say, a life-threatening condition or something that has changed, we can try and expedite those cases for you because we have that relationship with the county assistance offices. So it can take anywhere from 30 to 45 days to process an application, but it can be shorter if, we're there to help you and we get the documentation in, beforehand. It can go quicker.
So my friends, what I would recommend, we're going to put on the screen now the email. Get this information so you know what PATS is all about, especially if you don't have insurance. It's on the screen. Find out some of the things, because therefore you could ask them questions and
Absolutely.
see if they apply for that. Okay, I just think this is fantastic. And the hospital is offering this to anybody.
Oh, absolutely. And so, they also have bilingual representatives at the hospital as well. So we're trying to meet the community at where they're at. If, you don't, English is a second language, or you need that level of support, we do have members that are bilingual. So I just wanted to let the community know that as well.
How long have you been doing this?
I've been doing it 30 years.
No, it's the first time I'm hearing this. It's amazing, especially people are, if they're hesitant to go and get health care because they don't have insurance, you have an opportunity here now. I just think it's great.
Yeah, we absolutely love helping people, especially in our hometown communities where we grew up. And, we want them to worry about getting better and getting well, and we want to take this piece away and make it seamless and easy and stress-free for everybody.
Let me tell you,
and we'll take the stress on. You worry about getting better and getting the care you need.
That's key.
Right.
Especially, it's a big relief to know, I can go and get my health care, and, where there's help out there. That's a major relief, I'm sure you're going to extend a lot of lives by the fact that you have this, okay? Anything you'd like to say before we go to break? Anything else, Farrah?
Just, we look forward to helping you with your financial assistance needs.
Okay, and remember, my friends, the email's on the screen. Tammy, nice seeing you.
Always.
But you're going to stick around, right?
Yes, I am.
Stick around. Folks, we're going to take a break. We'll be back right after this. Welcome back to Your Health Partner, brought to you by Lehigh Valley Hospital, Hazleton. Joining me is Tammy Torres, who is the president. Also now joining us is Devon Trolley, who is the director of Pennie. Now, we're talking about medical assistance, getting aid. Now, there's a difference between PATS and Pennie, and we'll explain what Pennie is, correct?
Correct. And so Devon will go into Pennies and explain to you all about that, and we'll continue the conversation with Robyn around, PAFs.
What does Pennie stand for, and what does it mean?
Yeah, so Pennie is Pennsylvania's health insurance marketplace, and it's where people who don't have coverage can go anytime from their home, if you don't have coverage, to go and get health insurance. And the key differences are that the health insurance is high quality and that you can get financial assistance to reduce the cost. So both Medicaid and the health insurance marketplace, Pennie in Pennsylvania, provide people with the ability to get medical coverage so they can get care when they need it. And you will qualify for the program depending on income. So if you make too much income for Medicaid, it's likely that you qualify for coverage through Pennie.
Okay, is this like a health insurance program?
Yes.
Okay, and so what would be there are qualifications, correct? Can I call you and say, this is what I have, and if yours is better, or you're always trying to compare?
Yeah, so our programs actually, Medicaid and Pennie, work together. So they're a continuum based on income. So it really depends on income, and you only qualify for one and not the other. And Pennie is a great option if you don't qualify for anything else.
There are so many people that do not have that coverage. And as we talked about in the last segment, is the stress there of knowing, well, you don't have coverage, dad or mom or whatever, you know, so don't worry about that now, right? Because PATs come in when you're in the hospital, correct? And I could find out about Pennie before I go into the hospital.
That's right, and it's a no wrong door approach here in Pennsylvania, where if you aren't sure which program you qualify for, you can actually apply for either. So you can apply through PASS or Medicaid, or you can apply through Pennie, and we'll make sure you get to the right spot.
Okay, now this sounds a little bit confusing to me if I'm just listening. Okay, so let's try to review this, okay? Tell me briefly what PATS does and tell me what Pennie does. And can I contact both, or should I contact one when I'm not in the hospital or whatever? So review that with me.
Okay, so if you come into the hospital, whether you're coming, you know, through the emergency room or you actually get admitted, PATS is stationed right in the hospital. I have staff in the hospitals that will actually come to your room and help you apply for Medicaid and complete that Medicaid application on your behalf. We'll help you gather the documents. We will submit it to DHS and hold your hand from A to Z to make sure you are completely taken care of so you can worry about your health and getting better while you're in the hospital.
Good.
Okay? If you are not eligible for Medicaid, if you are over income, that would be the time that you would research Pennie and look into getting signed up with Pennie.
Okay, now you're not in the hospital.
That's correct. Yeah, we're a statewide program, and just to give some more dollars behind it, the income cutoff is about $21,000. So if you're an individual and you make less than that, then and you're in the hospital, PASS is the great program for you. If you make more than that, then you'd want to come look at your options through Pennie.
I just think this is great, but you know, I'm not surprised that Lehigh Valley Hospital would come out to try to help a lot of people. I wish you the best, and I hope our viewers take advantage of what you have so they could get rid of that stress that they have. Anything in closing? You got 30 seconds.
Oh my goodness, we want to keep everyone healthy, and we want to see you in sooner than later. We're here to meet your healthcare needs, and now we have a way of securing your medical coverage if you so need it. Thank you.
My friends, Lehigh Valley Hospital, I'm telling you, when you look at what they have to offer, it's just amazing. Hope we helped you. Remember, 24/7, you can watch all of our health shows on ssptv.com, our YouTube channel. Thank you for making the Sam LaSagne Show the #1 talk show in Northeastern Pennsylvania. I really appreciate it. We'll see you next time.